50% disabled PTSD, merely for the fact of income and not going fire, small arms fire in the perimeter. I would have never thought of going to any integrative medicine of any kind. And I met Dottie and I met Bob, and I'm following them wherever they go.
I'm Bob Deschner, and this is Dottie Goodson, and we were the ones that developed the TRIIP programs. That stands for Veterans Team Recovery Integrative Immersion Process. The goal of that TRIIP program was to see what we could do with more relaxation, more comfort, and better sleep. And what we found out is that when we reach this state of profound relaxation, after an hour to 2 hours on the table with energy and massage and chiropractic and acupuncture, not only did they feel better when they got off the table, maybe their pain levels were dramatically reduced to less than 1 or 2, their stress levels were also seemed to be down less than 1 or 2, but those benefits stayed with them for 2 days to 2 weeks. The veterans that are using that then to go into counseling and go into other programs find that they get better results. And that's really what the promise is for our program, that we can help the veterans get better results with everything that they do, whether it's regular life or whether it's therapy.
I've had the opportunity to interview some of the vets that have gone through the TRIIP program, and here are some of their stories.
Alfred, can you tell us a little bit about your military background?
I was drafted in June of 1970. That's probably one of the biggest lotteries that I ever had or ever won. And I was a clerk, but then I found out that my duties were going to be in the perimeter, in perimeter guard. So I spent most of my days and my nights in the bunkers and on foxholes in Charlie Sector.
Well, tell us some of your medical problems that you now live with.
I have problems. I have radiculopathy of my neck from C2 all the way to T1. I have osteoarthritis with osteophytes, and I also have bilateral carpal tunnel.
Okay. So are you in a lot of pain most of the time?
Most of the time I range in a scale from 1 to 10. I average about 3 to 4. I've learned to live with it, but ever since I started doing the Qigong and the Tai Chi and the TRIIP and my therapies at the VA, I've improved a lot. In fact, I wouldn't have been able to sit here and talk to you a year ago.
Tell me what you see of the benefits of you coming to TRIIP.
Well, the benefits that I get coming here is that my level of relaxation really goes up. My physical abilities with my arms increase. I am able to close my fists without too much effort. And my neck is the one that really relaxes. My back seems to get more relaxed, and overall, it's the level of anxiety that just dissipates. For some reason or other, just when I get up from that table, I'm floating.
I've heard that people coming to TRIIP, it's easier for them to go to their counseling sessions at the VA. Could you comment about that? Has that been true for you?
Yes, it is true. For the simple fact that going to the VA, it's like a challenge. You're confronted with authority. It feels like it's authority, and you're being challenged. And sometimes, well, my experience with the prolonged exposure was the embarrassment. The embarrassment that, well, I'm going to say a soldier should not cry. Mm. And tears do come out. And that in itself is very challenging. Now you come to the TRIIP, it's different because people are friendlier. It's a friendlier approach. It seems like they care for you. It's a comfort zone. It's a comfort zone, and the challenge of being questioned about personal things is not there, so you feel a whole lot more comfortable than versus sitting down in front of the social worker or the psychiatrist. Or
anything else you'd like to share with people here that are listening to this?
through testimonials.
Mm-hmm.
I just would want to say that if there's any way that you can help these people expand or to integrate their program into an area where it would help more veterans, I think that would be just a great benefit to all concerned.
I am a psychiatric nurse, and I've been a psych nurse for 30 plus years. I was blessed. I was in charge of a 16-bed inpatient psychiatric unit at Oakland Naval Hospital in Oakland, California. The very first time I came, I was hooked.
And what was it that hooked you?
Well, first of all, everybody is very friendly. I mean, as soon as you walk in the door, you do not feel like you're being judged. You know, no one cares about what like focuses on what your illnesses are in terms of like mental health, those type of things. And the massage, the acupuncture, the chiropractor, the aromatherapy, and the energy work is all very effective.
Mm-hmm. What do you like most about it, or what has it done for you?
Well, I suffer with back problems. I have spasms in my low back. And believe it or not, I am on muscle relaxers, and I can take muscle relaxers every day, twice a day, for 2 weeks. And my comfort level is the same. It absolutely doesn't change. And the honest truth is, I can come in this door, and when I leave out this door, after 1 day of the modalities that I receive here, for this day, I leave pain-free and stress-free.
And how has that changed your life?
Well, anytime you don't have pain and you don't have a lot of stress and you feel too blessed to be stressed, you're going to have a good day. I'm a psychiatric nurse, so I work with a lot of people that I see how pain affects their life on a daily basis, you know, mentally and emotionally.
Mm-hmm.
So just to be pain-free, I mean, that's a good thing.
Well, you said earlier you had a story you wanted to share.
Yeah, I do. I kind of want to share testimony, and I don't know if it's something y'all going to keep, and it's just a little bit personal, but I mean, I think it's worth sharing. You know, I am a disabled vet, 100% disabled vet, and one of my diagnoses is anxiety disorder and social phobia. And I can honestly tell you that right now I'm not having any anxiety. I mean, part of my real story is that if anything has affected my life, my daily living, has been the social phobia. And it has been the anxiety disorder. And those are things that kept me from doing things that I really wanted to do, you know, a lot. I mean, it affects going to church. It affects going to a lot of things. But this is how important this place was to me today, that I was able to leave my house this morning and I was able to tap away, that is the truth, because I told Dottie on the phone, I'm going to tap away the nervousness to do this interview. Because, I mean, for me to sit here in front of a camera is amazing.
Is there anything else you'd like to add to your story?
No, other than I am so grateful for this place. I am truly grateful for this place. The first day I left here, I wondered, how could you offer this? I mean, you know, I just thought it's a great thing, but I just didn't know how you could offer this to the veterans for free, and I just think it's a great, great, great thing.
Hi, Ben. I'd like to ask you a few questions about TRIIP and your experience here. And when you first came in, what were some of your symptoms that you came here about?
When I first came here, I had a lot of problems with my left shoulder. I had some soft tissue damage that the Army and the VA couldn't get a good read on. They took a lot of x-rays and stuff. They couldn't figure out what was wrong with it, so they just gave me Motrin. So after I came here, with all the different modalities they use here, I've actually, in the last 4 months, my shoulder's gotten a lot better, and I can use it on a daily basis without a high amount of pain. The other symptoms I had was PTSD. I was having a lot of PTSD problems. I retired last year, and I had a lot of reoccurring stuff come up. So I started drinking heavy, and it didn't work out too good with the family and everything. And after I come here, my PTSD level has gone down a lot, and I've learned how to deal with it better through different the different things they teach here. Like Dottie teaches the emotional freedom technique, and that helps a lot. Even just dealing with normal stuff that isn't PTSD related.
Have you noticed any changes in the ability to sleep better?
I definitely can sleep better now after I've been coming here. See, about August of last year, I'd sleep a broken 4 hours. I'd go to bed late. I'd wake up early. I'd be tired all day. And now I can actually go to sleep at a decent hour, around 10 o'clock at night, and get up about 6 in the morning. Usually sleep all the way through. I don't have any problems until early morning. One of the things that helps out a lot is just knowing that somebody cares about you and they're trying to help you, and there's nothing you have to do. They're just doing it out of the kindness of their hearts, and all volunteers. So I know that helps a lot, because sometimes after you get out of the military, you feel like you left something behind and there's nobody there for you anymore. There's nowhere to go forward. So I know that helps out a lot. See, when I first started coming here, I was already retired from the military, and I didn't get out much. I didn't do anything but take my kids to school and watch TV and drink beer and rinse and repeat the next day. So I've been able to get out a little more. I just went to a Spurs game on Friday. That's about it.
Good for you.
But it wasn't about going to the game. It was about getting out in a public place and not being as nervous and upset.
So now you're driving better and you're sleeping better?
Driving better, sleeping better. Yep, definitely. A lot has changed.
Okay. Jennifer, thank you for coming for these interviews.
Thank you for having me.
Yes, and tell us how you found TRIIP. How did you even get involved in this?
A friend of mine was my platoon sergeant back in Desert Storm. I've been in touch with him the past year or so, and he told me about this and how great it is. And I've been coming since August, and wow, I mean, it's hard to describe just how wonderful the modalities are, and the physical and psychological, sleep better, feel better.
What were you like before you started coming, and what do you like now? What's the difference?
I've got a lot of chronic pain from some scar tissue on my back, and that's at least 50 to 60% better ongoing. And I hadn't really slept, and I didn't even realize that. I haven't been diagnosed with PTSD or anything like that, but I rested, but I didn't sleep. And I, wake up at the drop of a hat. And some of the treatments I've had here, are deeper than others. And sometimes I walk away and just don't realize. It's like when you have a head cold for a month and you forget what it's like to breathe. And then all of a sudden it clears and you realize that you weren't breathing through your nose for a month. So you don't realize how bad it is until it's fixed.
So what level of pain would you say you were at when you came in?
7 and 8 maybe.
Constantly?
Off and on.
Off and on. And now what would you say you're at?
In between treatments sometimes, and I've also had a fractured hip that kind of compounded everything. And it's the same area where my other scar tissue was. In the past 2 months, it's been 4 to 5, and then during treatments, it brings it down to about 1 to 2.
What's been the most important benefit from being here?
Just the layering of them, how the massage, they really have a synergistic effect on everything, that the energy is better because of the massage, and the chiropractic is better because of the energy, and just how everything works together. And for me personally as a nurse, I'm interested to learn more of it and maybe do my federal time and retire and get into something like this and give back what I've received. And also just that is what I see as a nurse. I see people coming in with pain, psychological issues all the time, and it's the same. They give a medicine, Vicodin, whatever, and nothing changes. And here, not saying that it's going to fix everything 100% overnight, but it's over time, it does. You actually fix the problem instead of just popping a pill.
Where do you think you'd be without that trip?
Probably stuck in the hand-to-mouth, day-to-day, getting by. And just the working of the energy and everything has just kind of brought me back to center. And I don't know, I just feel better.
Better emotionally, physically?
Just everything.
Everything. Mentally, spiritually?
It's hard to say. It's just, I feel good.
Yeah.
About a year ago, the vet trip had approached me. And they had said to me, well, have you ever had any kinds of massage or anything to help you, to relax? No. And so they said, well, I will bet we can get you off that table feeling like Jello. I'm like, well, you go ahead on. Because
you just try.
It's a tough broad. This is it. It's not going to happen. That's exactly what I said to them. I'm an old broad, and I'm a Vietnam veteran, and you go head on. So they did bless their hearts. And I've been seeing them for about 6 months now. But I believe it's right about the third session that I had with the vet trip that I can honestly say made a significant difference in that I allowed myself to engage in the process. And it's when I made the decision to engage in the process did I feel very different inside in terms of how I was feeling. My stress level was like down to 0. I suffer quite a bit from foot pain, and I have some arthritis going on in my lower back. But that one particular session, I guess it was just the perfect thing to be here, because I walked out feeling like Jello.
And that was their goal, was to feel like Jello.
That was their goal, was to let Jello walk out of here feeling like Jello, and they did it. They accomplished it, and I said, this is it. I'm Jello today. In the beginning, the changes were short-lived. They were very short spurts of feeling good. I'd leave, and I would feel fantastic. And then, of course, the little aches and pains and all that stuff started coming back. However, as of last week, I had a conversation with Bob and Dottie, and I said to them, I'm actually going to call my physician's office and get off this pain medication that I'm on. Because the lasting, the no pain and how long that lasts after these sessions has been incredible. Incredible. I leave here and it just takes so much longer for the pain to come back every time. The last session that I had, when I had made this decision to get off these pain medications, I had said to myself while I was on the table, I could feel all these hands and all this breathing going on, and of course the ambiance is just beautiful and so conducive to healing. That is precisely what's going on in there. That is exactly what is going on in there. And I felt as though there were a room full of angels' hands just working with people. It was just incredible, and it was so, I was so delighted that I started crying because of that, because it felt so beautiful.
So you were crying from joy, not sadness?
From joy of feeling no pain for a long time, and just kind of like the thought of just having a bunch of angels around you working on you to make you feel better. Since I left the military, because I had worked quite a long time on the flight lines. Okay, I was in aviation. And my job was to hang out around airplanes day in and day out. And I was on my feet constantly. So apparently it appears as though, through the testing through the VA, that my arches fell. And so once I got out, excuse me, I've had a lot of burning sensation. The best way to explain it is I'm walking on hot coals every day, walking on hot coals. I used to enjoy playing sports. I played volleyball and baseball for the Navy. I did all that. I love to play squash. I like to run.
So give us a number. Like originally your pain in your feet was on 1 to 10?
I was off the chart.
Off the chart.
Yeah, it was off the chart. In other words, if I could tell you and describe it to you, that I was walking on hot coals or pins and needles going into my feet. I just dread putting my feet down. when I was sitting in, oh, here it comes.
Mm.
And now, I can walk around, I can walk around freely. Okay, I can stay at the grocery store, I can go do my day-to-day activities, but the quality of my life has improved drastically.
I would think so.
Drastically.
And so from off the charts to what now? Are you at a 2 or a 3 or a
Right
0?
now, I'm at like maybe a 2.
At a 2.
A 2 or a 1, yeah.
Mhm.
I know the tingling's there, but it's not hurting. Just to share with you that I have been seeing over at the vet center
Mhm.
for a year. And
And is she a counselor or
she's a therapist.
therapist? Okay.
And we've done some beautiful work together. But I can only imagine that TRIIP coupled with her discipline. I can't go wrong. I think the quality of my life will completely change. I think I will be much happier. I will know who I am. I will be able to be good again and get out and fix relationships and build relationships and just have a different quality of life. Because I've been homebound, though, I would say. Probably the past 3 years of my life have been pretty homebound. No social life, recluse, Can't do anything with my feet. Oh, let's go to First Friday. No.
Can't walk.
Can't walk.
Mm-hmm.
No, can you imagine? Can you imagine the possibilities?
Is there anything else you'd like to share with the viewers that are going to be watching this?
Is if you give it a chance, because there's just so much skeptical stuff that maybe somebody's saying, man, this might work, it might not. If you give it a chance, and resign yourself to it, and engage yourself in that therapeutic feeling, in that process, it will take you places you would imagine.
Violet, first I want to thank you for coming to do this interview. And I want you to begin by talking about how you found that TRIIP.
Well, I found that TRIIP because I had been I was dealing with doctors for about a year and some, trying to figure out what they can do for me, because I suffer now from RSD, that's reflective sympathetic dystrophy, and it just causes all my nerves to go off firing without any cause, so I'm constantly in pain. There's nothing really the doctors could have done for me.
Mm-hmm.
And like I said, I was with them for about a year and a half. They just kept feeding me pain pills after pain pills, but it wasn't enough.
Yes, I understand that RSD is one of the most horrible chronic pain issues. So you've been dealing with a lot for several years.
Yeah. I wanted the doctors to amputate my arms.
You wanted the doctors to amputate your arms, my goodness. You were almost ready to do that?
Yeah. But it's with RSD, since I did some research on it. If you cut off the limbs, it won't matter. It just transfers to another part of your body. Very active person.
Mm-hmm.
I love doing things. This is a person who worked 24/7 and enjoyed life as well as worked hard. Played with the kids and active sports and everything. I just love life. I could say I had it all.
And tell us what's happened since you've been coming to VetTRIIP about your RSD pain.
Well, the thing was that since I've been dealing with the doctors, they told me that I couldn't do very much. It's something I'm going to have to live with. And by coincidence, two of the neurologists that I was seeing happened to be at this clinical. And that's where Bob was at. And he overheard them talking about me, so we went and gave them their card. And then in turn, thank God, the doctors called me and gave me his information. And I thought about it. I wasn't really sure what it was about or what they were going to do any different from the doctors that I've already seen. So I called him one day. I was already at the last of my wits. It's on a Sunday. It was in the afternoon. I was just suffering with pain. I couldn't bathe. I couldn't wash my face. Dress myself. So on that day I called him and I got a voicemail. And I thought, well, you know, they're closed. It's Sunday.
It's Sunday.
Yeah, they're not going to do anything. So I left the voicemail. And I guess like 2 hours later he called.
Mrs. Bob called?
Mrs. Bob called, yeah. He called and I told him what was going on and he said, I'll be there at 6 o'clock.
I have a hunch these are tears of joy instead of sadness. Am I right?
Yes.
Yes. Tears
so
of
happy,
gratitude.
so, yes.
Yeah, tears of gratitude.
I just couldn't believe it. I was so happy, so ecstatic.
So what happened when Bob got there?
Well, he got there, you know, he saw me in pain, and he goes, okay, you know, don't worry about it, we're going to take care of it. And as soon as he got there and just told me that, he started doing these touch techniques.
Mm-hmm.
And I kid you not, in less than 10 seconds, the pain dissipated. I was so relieved. I was amazed.
And so now what happens when you come to the Monday vet trips here in San Antonio?
Well, let me tell you, I can dress myself. I can bathe myself. Every time I come here, I look forward to it. This is my way of healing myself. I mean, I still go to the doctors. I have to.
Mm-hmm.
But I don't have to take as many medications. No, I just have to show up. And he does his touch techniques and all the other volunteers that do so much for, you know, I guess the people that have the same problem that I do. It's been a miracle.
Mm-hmm.
Now I can actually say I enjoy life.
Mm.
I would enjoy it more, but from what I've been through, it's a miracle.
Hi, Tony. Thank you for coming.
Thank you.
And tell us a little bit about how you were introduced to Vet Trip. How did you find Bob and Dottie?
Oh, great story. My friend Violet is very ill with a disease that's not very well known amongst the medical community. There was one day she was screaming bloody murder. I think her pain level was, they say 1 to 10, it should really be 1 to 1,000. I couldn't stop her pain. I couldn't stop her from crying. And so we made the phone call, and he and his wife showed up that night. And I'm telling you, her body, her facial expressions, everything just changed when he just did what he does. And when I saw that change on her face, I knew that there was something there. The skepticism was gone. But I'm telling you that for myself, not just from witnessing, you know, my friend Violet go from just depressed and laying in bed and angry, okay, very angry at the loss of her way of life, very active person. Now I see her actually able to do her activities of daily living, where before even washing your face, brushing your teeth, combing your hair was not possible. I see Violet now no longer angry or depressed or afraid. She's actually doing things, you know, slowly, and she believes 100% in what Bob and Dottie are doing. I believe 100% in what Bob and Dottie are doing, and I feel it myself. I experience myself. I'm not just talking for Violet. I'm not speaking for anybody else, but for myself, I feel so. You can actually feel the pain leaving your body. So September 16th, it was a drizzly day. The back steps of the house were slippery, and I slipped, and I came completely off the ground and landed right on the steps. on my back, different parts of my back. And that really hurt. I thought I had broken my back.
Talk to us a little bit about what it's like for you to be on the table for those 2 hours. What do you experience?
I feel safe, first of all. I know that the people that are there for a goal, a common goal, and that I am there for repair, healing, and we're all kind of in union, even though I don't know them, what they're doing outside of here. I know in here what they're doing is a common goal. I know that I can trust them. I know that I'm going to be taken care of and respected, and I'm going to feel great when they're done. And I think that what they do is so important that I respect them as well. It's a mutual respect.
And so how many sessions of vet trip did you have to do before you experienced relief?
The very first one.
What would you say your physical pain level is now?
After today?
Yeah. 0. All right. Hi, Ken, and welcome.
Thanks for having me.
Right. Tell us a little bit about how you found Vet Trip and how long you've been coming.
Well, I've known Bob and Dottie for years, and they've counseled me and helped me come along. And then I've really been with Vet Trip from the beginning.
Okay, so the beginning's been about 4 years ago, I
Yeah.
think. And why did you need to come to Vet Trip? What was going on with you?
I have pretty severe PTSD, and I also jumped from planes in flight, and messed up my knees and back.
Uh-huh.
So ever since I left the service, my knees and back have given me problems.
And what happens for you when you come for sessions with Vet Trip?
It's magical. That's the only way I can say it. It's magical.
Magical.
I come in always in at least some pain. And whenever I leave, it's like I always leave in almost no pain.
Down to 0, huh?
Yes. And I've been really bad because I've come in the walker. I've had it so bad. And very seldom have I been able to walk without a cane. And now, as you see, I can stand up tall and walk again.
I see that. I see.
I believe it's largely credited to the veteran.
How long will your pain be gone between sessions if you only come every 2 weeks?
Well, it used to be, it was just a lessening every time.
Okay.
And now, for the last 2 months, I guess, 2 months, I can go 3-4 days with no or minimal pain. And then it gradually will start coming back. And thankfully they have a Monday session coming up.
Yep.
So after the weekend, I get cured again.
You get cured again, yeah. Well, tell me, you mentioned that you had PTSD.
Yes.
And has this program helped you with any of those kinds of symptoms besides
Greatly.
pain? Greatly. So can you explain how that's happened, or what's happened, not why, but...
The change, I think part of it is some of the aromatherapies, the relaxation techniques. I do the tapping, and the first thing is I stop being as paranoid.
Well, that's important.
Yeah. And then after that, I started being able to sleep a little better. And after every session, especially now for about the last 3 to 4 months, I sleep a whole lot better.
Wonderful. And when you can sleep, then you can be more stress-free.
Yes.
Right.
And I can wake up as opposed to have been up. And that's made a major difference.
Talk to us about the tapping. You said you use it and you like it. How does it help you? What do you do?
Especially when the PTSD starts kicking in, I feel it starting to come on. I can do the tapping, my hands.
And what do you say to yourself when you're tapping?
That I'm okay.
Okay. I'm okay, and you tap. Huh?
I'm okay. Everything is going to be okay. I'm blessed.
Okay. Show us exactly how you do that. Do the words and the tapping, and just show us what you do.
Okay. I'm okay. I don't have to worry. I don't have to fear. I deserve to be here. I deserve to enjoy life. I enjoy the people around me. No one here is here to hurt me. I don't have to hurt anybody. It's good to be alive.
Mm.
I'm blessed to be alive.
That is beautiful watching you. Just beautiful. I'm sensing some emotion coming up as you do that.
Yeah.
Yeah, what's happening with your feelings?
It's sort of like it helps wash it away, but you can't really wash it away without seeing it.
So you're seeing some of the memories
Yeah.
as you're tapping and releasing.
And then after seeing it, I identify it and then let it flow off like water.
Nice. Nice. So it's a letting go process
Yes.
for you. Mm-hmm.
That's for me.
For you. Do you use it a lot in your daily life?
Often enough,
Often enough. Okay.
especially controlling my temper.
What's been the best thing that's happened to you here?
The best thing?
Mm-hmm.
It's hard to say. It's because it's peace of mind, it's physical improvements, it's the getting in touch with Earth, getting in touch with myself. I don't know how to pick one.
Okay.
It's better than any of the others.
Right.
EFT is the emotional freedom technique, and we use it in a group setting for stress reduction. It's tapping on meridian points on the body, on the head and the chest, and you just use your own fingertips to do the tapping while you're acknowledging some kind of problem like stress, and then acknowledging that you accept yourself and the situation. And we just do these rounds, 2 or 3 rounds together in a group with the veterans just for stress relaxation before they get on the tables. But it's also a way to teach them a self-directed technique that they can use on their own for anybody with post-traumatic stress symptoms that get really bad. If they can catch those soon, early in the stage, start the tapping, their whole body chemistry can relax.
Here at the Vet Trip, I've learned emotional freedom techniques and a lot of the relaxation techniques that I need for my comfort.
And sometimes even just driving down the road, you get a little upset when somebody pulls in front of you, or something stupid happens, something falls off a truck and almost hits you, so you have to swerve, just little stuff like that. And it just raises your stress level and it makes you really upset. And I know with me and a lot of my friends that I went to Iraq with, we have anger issue problems. So it's not like, you see something on the road that scares you and then like, oh, I'm scared to drive. It starts making you mad because you want to do something about it because you always taught if there's a threat, you eliminate the threat, so it makes you start more angry and angry, and next thing you know, you're starting to sweat and shake, and the EFT really helps calm you down.
And could you show us a little of the tapping? What do you do when you do EFT?
So I usually just go right around the eye and then down like in almost like a little question mark. Let's keep on doing that and try and repeat something positive that God taught us how to do, and it helps calm me down a lot.
Show us how you tap away your anxiety.
I am not going to panic today. The worst that can happen is they would cut this interview. I want to be here today. I'm going to do this today. So I've used the points that they showed me here and here. You know, I may not have them exactly right.
But it works anyway.
But it works anyway. Well, it's kind of a big fun here, but you know, you tap yourself on the head as the hairstyle. But it really does work.
And I find it fascinating that you've accomplished all this without any counseling.
You do not know what biggest step this is for me today.
Okay.
It truly is a big step.
Wonderful.
Everything is okay. I'm okay. I will be okay. I'll be better tomorrow than I am today. Everything is good. God is good. Things that God created is good. Everything is going to be okay.
One of the most amazing things about the Vet Trip program is the number of volunteers we've had come forward to help our veterans. We were first seeing this happen in Austin, where we had so many people calling the VA asking to help, and they wouldn't even return their calls. So we used that as the basis for the program in Austin. And now in San Antonio, we've had over 185 days of professional times donated to the program for free. And we're now generating about 40 professional days a month contributed to this program to make it successul.
Dr. Best, I know you've been one of the volunteers that's here on a regular basis with Vet Trip.
That's right, yeah.
And what brings you to do this work?
I get a lot of satisfaction out of working on people that, first of all, have a lot of problems, but they respond very well to the combination of treatments that we use. They're also very appreciative. You see some of these people that come in and they're very, they may be kind of stony and kind of closed off when we first start working with them. And when we get done, they tend to be a lot more friendly, a lot more open. Some of these really hardened combat veterans, actually get up and smile and give you hugs even, and that's kind of a nice feeling to see that we're able to actually make a big difference for these people in their lives.
How is it working with this group of people where you have 3 or 4 practitioners working on the same person? How is that different from the work you do in your office where you're the only practitioner?
It's really nice to have the blend of different techniques because for me as a chiropractor, where I'm trying to get joint movement, restore normal muscle function, if somebody's coming in and they're clamped down and they're just as solid as a rock, it's very difficult to get anything to actually change for that person. Whereas with using these multiple techniques, I usually come in after they've had energy work and massage therapy, and by that time they're fairly relaxed. Things are a lot looser. It's a lot easier to get things to normalize on them. So it makes it a much easier process for me after they've had an hour or more of work, and they've also had emotional freedom technique to release some of the emotional things that are keeping them tense. So all of that combined makes it a much easier process for me to do what I do.
I like to volunteer at the Vet Trip because I know the people that come here really need some help, and they're looking for help, and when they come in here, they're in a lot of pain, a lot of issues going on, and this program really helps break through a lot of that to bring military PTSD vets back to normal life. And it's great to see the process that's going on.
And what keeps you coming back as a volunteer? I know you volunteer your hours every 2 weeks.
Yeah, I volunteer. I keep coming back because I feel that it's a great program, and I'm doing some benefit here with the program and helping out. Just seeing the improvements from week to week with these people is it's heartwarming for me to see that going on.
What's it like for you to work with the other practitioners? Because this is a very unusual program in that you have 4 people working on the same client on a table. So what's that like for you?
Oh, it's incredible. You got different people working on the same person, and not all the modalities by themselves can help with that, but when you integrate everything together, it's incredible. You go in with the energy work, the massage, chiropractic, everything just meshes very well together to release what needs to be released sometimes it takes a little bit, sometimes it don't, but all of them working together is just incredibly powerful.
Tom, I know you work here as one of the practitioners, and tell us how you got connected to VetTRIIP and what you actually do here.
All right, well, I was actually seeing a counselor at the VA, and they referred me to Dottie, which she does EFT, and so I sat in with Dottie for quite a few sessions of EFT, and it was really at the beginning of VetTRIIP, and she was telling me that they had this and that it would actually be a good part of my therapy to be able to connect with all these other vets. And so I started right from the beginning.
What is it exactly that you do here now as part of the work that you do?
Right. I help Dottie a little bit at the beginning as the vets are coming in, just getting forms ready, just kind of some administrative stuff. But the main part of what I do is to talk to vets after, make sure they fill out the other form, the outtake form. But then I ask them a lot of questions about their experience, about what was the difference between when they came in and how they feel now. And it's amazing that they're just getting off the table. They're so relaxed, and so vets oftentimes tell me things that I never would expect that anyone would tell me after just meeting them one or two times.
So they're very open when they come off the table.
They're very open, much more emotional. Usually they come in, some of them, especially some of the Marines and the real macho people will come in and they're like, all right, well, I'll do this, but they're not really sure if it'll help them. And they kind of get off the table like, what is it, Madonna says, like butter,
like butter.
And they're just really relaxed, and it's beyond relaxed. I think they're open to their own feelings about what's going on and what their issues they have to deal with. Mm-hmm. And it's something I never anticipated.
Our goal for VetTRIIP in the future is to expand to other locations throughout Central Texas and showing local communities how they can come together with volunteers and help their veterans recover and come back and integrate into normal life. At that point, we want to be able to make a model that we can duplicate throughout Texas and throughout the United States. The funding that we're seeking will allow us to not just help the veterans here in the San Antonio community, but to make a program that we can duplicate and approach the challenge of helping 740,000 veterans to recover with PTSD and the other 1.5 million veterans that may not have post-traumatic stress disorder but definitely have stress and challenges coming off the war experience. We feel we can help those people, and it's going to be a community-based, patient-centered, complementary and integrative medicine approach that's going to do the job.
Brother, come home. Brother, come home. You've been away far too long. You went off to fight, and now I cry every night. Brother, oh brother, come home. You are my light, brother, you are my light. You were 12 years old when I began my life. You taught me to throw, and when your friends said let's go, you told them you'd be with them in a while. They told me you'd gone to protect us at home, but you've always been a hero to me. Now it's been too long brother, come home. You've been away far too long. You went off to fight, and now I cry every night. Brother, oh brother, come home. Hey, mama dear, what are all those tears? She said, come here and sit by my side. Brother's on his way home, and it won't be long. He'll be in that heavenly